We have heard, the World Health Organization has even said that not a single person in the world has died from the Omicron variant. Why is everybody freaking out about it?
You know, that's a great question, Governor. We are making such a big deal over this, and there's so much fear being generated because, frankly, I think people just say we don't know. But if we look at the South African experience and listen to what the doctors there are saying, this seems to be a variant, they call it a VOC, a variant of concern, like Delta, that quickly replaced Delta within 2 weeks or so in South Africa. But what we're seeing is it is more infectious, it's more transmissible, but with much less severity of disease. So this could potentially be the end of the coronavirus pandemic.
Because it would be that we're getting to herd immunity?
Yeah, exactly. Because if it's so transmissible and people get infected, but with nothing more than a mild cold for most everybody, then people could develop natural immunity, and then it's over.
Dr. Fauci will be crushed if
will.
it's over. And I say that somewhat facetiously, but I'm beginning to believe that there's some people in the public health community that want to keep us locked down and afraid. And I'm thinking, you know, there comes a point at which we've got to get back to living. There's certain risk. We all understand it, a risk not taking the vaccine, maybe for some people a risk in taking it. But the bigger risk is that we curl up in a fetal position, hide under our beds, and stop living.
Exactly. And the damage that this pandemic has done to the world is irreversible, I think. And it seems like they want to keep continuing the fear-based insanity, locking people down and everything else. So, and I understand there has to be some caution. When it first started, we just didn't know what we didn't know, and there was a lot of fear, justifiably so. But as we gained experience and as people got immunized and as people developed other medications that could treat it or discovered other medicines like ivermectin and hydroxychloroquine, I know there's a lot of controversy about that, then we began to see that, you know, we can actually survive this. I mean, in the U.S., for example, the fatality rate's about 1%, not greater than that.